Good afternoon, everyone, and thank you for sitting in and hearing my dissertation proposal. And in this defense, my name is Sal Bondoc, and today I'll be presenting my proposal titled "Underrepresented Minority: Students' Perspective on Experiences with Academic Success in Graduate Health Professions." I also would like to just first thank Dr. Letizia and Dr. Snyder for serving as my dissertation committee chair member. Um, it's kind of, I don't know, I find it serendipitous that both are angels. So I appreciate it. So for this presentation, I'll follow this outline, starting with my problem statement and then ending with my research methodology. So start with the problem statement. What really inspired me to pursue this research is this idea that as our nation's diversity increases, that we are not seeing the same level of diversity in the healthcare workforce, especially, the representation of minorities who are considered underrepresented in healthcare, particularly African Americans, Hispanics, and Native Americans. This is pretty problematic. And why is that? We established that, a diverse healthcare workforce correlates with improved healthcare access and reduced healthcare cost, as well as an enhanced patient experience. Patients tend to pursue services that are provided by individuals with whom that they identify as similar or the same ethnic or racial background. And so our issues with access and healthcare quality are mitigated by having a more diverse healthcare workforce. So one of the reasons, if not the main reason for lack of diversity in the healthcare workforce is a weak stream of underrepresented minority students into health-related profession programs. Despite underrepresented students comprising a significant percentage of the healthcare workforce, that is still a lot more along with lower level positions like patient care technicians, home health aides. But when it comes to direct service providers, especially in allied health, like physician assistants, physical therapists, occupational therapists, we don't see the same degree of diversity there. And as you can see in the table here, that the percentage of matriculants as well as the number of students who are graduating from programs from national data, does not necessarily reflect what we would expect as the healthcare workforce should be, and the number of the diverse patient populations that are seeking care or in need of care. So that said, the problem of a lack of diversity in healthcare has long been identified, more than 2 decades. And there's 2 seminal documents that have been put forth and adopted that kind of led to more research funding efforts to increase the diversity in the healthcare workforce. However, despite decades of efforts, there's little progress in achieving a sufficient diversity in the workforce, particularly in healthcare. And one particular study that continues to capture or makes it salient that this problem continues was that from Salzburg, where he and the research team looked at the diversity indices for 10 most common healthcare professionals, and certainly, the three disciplines that I just highlighted in the previous slide, PT, OT, PA, are certainly among the least diverse. So what I'd like to focus on in this proposal is particularly on the nutrition retention and the academic success of underrepresented minority students. For one, the healthcare stream or the stream of students going into this program is already weak, but then the output following admission into these programs is just as weak, even weaker. And what I wanted to do is to pursue more of a qualitative methodology so that we may achieve a deeper understanding of the phenomenon of academic success. And truly, it is emphasizing grounding in the perspectives and experiences who live or embody this phenomenon. In particular, I'm pursuing a grounded theory approach, which goes beyond describing individual experiences and perspectives, um, and more into the development of a theory that is hoped could be an element that would advance future solutions. So my research question is centered on this big topic: how do underrepresented minority students navigate and strive to achieve academic success in their health professions program? And there are, underneath that large question are smaller questions that will contribute to theory development, and they're listed in here. So I'm going to now talk about a little bit about the literature related to this particular topic. So in my literature review, I'll present relevant works at addressing diversity in the health professions. Much of the literature in health professions education in particular centers around the starting point of that stream, and that is admissions and recruitment. Although my topic is all about academic success and retention, it's worthwhile looking at this broadly and as a continuum, from admission all the way to graduation. So generally speaking, we know, well, first, I'd say that, based on a scan of different health professions that were mentioned earlier and more, including medicine, nursing, dentistry, pharmacy, there's a lot of movement towards increasing the diversity of their own professions and disciplines. And some have funneled their research dollars or their allocations to conduct program development and research on pipelines or pathways. But then the issue here is that there remains a bottleneck when it comes to making admissions decision. For one, the health professions programs remain highly selective. And secondly, accreditation requirements include demonstrating positive outcomes such as, meeting the threshold for what is considered as acceptable percentage of licensure pass rates. So not only these in of themselves can create bottleneck and constrain the ability of these programs to be more inclusive in their admission process. There's also this known phenomenon of underrepresented minority students or standardized testing not friendly to admitting students who are coming from diverse backgrounds. So what is commonplace is using more quantifiable academic factors, GPAs, GREs, to determine these admissions decisions for the reasons that I mentioned earlier. And this has been heavily criticized by different associations, societies. One is the American Association of Medical Colleges, and they were one of the strong force that advocated for more holistic type of admissions. So in my review of the literature, there's very few small scale studies around the use of holistic admissions. The ones that bit the bullet, so to speak, have demonstrated a positive trend towards increasing the diversity of their admissions pool. The question remains, just because your matriculants, the diversity of your matriculants have increased, are your graduates also pretty as diverse as your total enrollment? And the studies that are highlighted in this slide have not demonstrated that. There's also now moving towards retention. There have been some studies that look at individual attributes of students on what sort of attributes are associated with their ability to persist and be successful in these programs. So there's a lot of literature in medicine and in nursing, and they pointed out things like the idea of conscientiousness and the idea of perseverance as personality or attitudes or student attributes. Now, for the allied health professions, OT, PT, PA, um, there's not a lot of studies, but certainly there have been demonstrations like case reports and case studies that do indicate some similar findings and then some. And and you can see from the dates of the studies that are cited here, they're a lot later compared to the ones that are done in medicine and in nursing. There's also a distinct difference there that in the literature in medicine and nursing, there's not a lot of mention about or disaggregation of the data to identify whether these generalization of findings do apply to this underrepresented minority groups. So now there's some promising studies as of late, in particular, these two comprehensive mixed methods studies are in the Midwest using community-based participatory action, where factors were identified as potential barriers to access and success. So we're talking about not just retention, but also recruitment. And some of them include, family support, finances, lack of community support, lack of academic or career preparedness to pursue these health-related professions, etc. And the social factors like discrimination, microaggressions. And some of these studies are also reflected in other theoretical papers that or expert panel reports such as Turetsky in coming up with some models that would hopefully increase the diversity of the healthcare pipeline. Now, digging back into studies that are outside of health professions but more general, higher education. So Manyanga and colleagues conducted a systematic review and particularly focusing on various models of retention. So, big theories like Tinto and Bean have been mentioned in the synthesis paper, but then in their synthesis, in Mayanga's synthesis, there are two general findings. One, that there are multiple factors that contribute to or are predictive of retention and student success, again, generally speaking, and that models evolve over time because populations also evolve. And the evolution of these models tend to coincide the evolution of the student body in higher education. So with that said, I thought that I would utilize Bronfenbrenner's ecological systems model as the theory that will frame my research. And in the Bronfenbrenner model, there are various levels of influence that also interact with each other, that over time influence the development of an individual, or influence their behaviors, their attitudes, their development, and all of that. And so in applying that model, I came up with this conceptual framework that pulls from the various literature that I have mentioned earlier, especially the synthesis that Manyanga and colleagues, as well as Creighton, have done. And so all of these elements are arranged in a similar way that Bronfenbrenner proposed the different levels of systems in that ecological model. There are some influences that are more at the micro level, all the way up to the macro and exo. So now I'm going to move into the methodology. As noted, there are qualitative studies and quantitative studies as well involving underrepresented minority students, but especially with qualitative studies that subjective experiences have given insights and clues for further knowledge exploration. So in the mixed methodology that I mentioned earlier with King and Johansson, that they concluded that there's more work to do, and as with any research, right? But there's these lines of inquiry really point to the need for more qualitative work, taking a deeper dive because the voices of the underrepresented are not represented in the literature. And so it is with that idea or that inspiration that led me to this path. Because little is known about underrepresented minority students' experiences navigating health professions program, I particularly chose grounded theory design, especially this model called constructivist grounded theory design. And when we have time, I can kind of talk about the different grounded theory designs, but I particularly chose constructivist. Constructivist because the researcher is an active participant in the co-construction of meanings with participants. And it requires to apply my lens as a researcher, as both a healthcare professional and an educator. Um, Also, I consider myself as a minority individual, um, and so that we can develop a more nuanced understanding and arrive at a degree of theoretical sensitivity in the process of knowledge co-creation. So ultimately, this approach, this constructivist grounded theory design, may lead to the emergence of new knowledge, a theory that is truly grounded in the data. So the process of data collection and data analysis. Well, anyway, what is unique about grounded theory is that the process of data collection, data analysis, um, is cyclic and iterative in nature. It's not sequential per se, but rather it's iterative, right? And like I said, so cyclical. But then there will be, throughout the stages of data analysis, data collection, there will be a gradual shift in the sampling. There's a gradual shift in the coding methodology, even in the process of data collection. And as shown in this framework, this design framework, there's the initial, then there's the intermediate and the advanced coding phases, leading to theoretical integration and the development of the theory. First, the central phenomenon, and then the theory itself. So I'm going to expound a little bit more on that. But before that, the sample and the participants in this study will be from accredited physical therapy, occupational therapy, physician assistant programs in the Northeast and the Mid-Atlantic region. I particularly chose these regions because we also know that there's a higher concentration of diversity and higher concentration of higher academic institutions. And based on my work in accreditation, there's a lot more academic institutions that offer these types of programs in both the Northeast and the Mid-Atlantic. Um, Certainly, they must be currently enrolled and they identify themselves as underrepresented in healthcare. And we can say underrepresented for everything, but underrepresented in healthcare means African Americans, Hispanics, and American Indian. Um, my initial recruitment strategy is to contact, a group or a number of institutions in the Northeast, five each from the Northeast and the Mid-Atlantic as my initial foray. And as mentioned earlier, the approach to sampling will evolve over time. Initially, of course, it's purposive sampling based on the above criteria, but then it will evolve into purposive sampling that is theoretical based. There will also be elements of snowballing in there. Um, Based on what Cresswell and Gutterman suggested, minimum of 10 is needed, but because I am looking at a cross-context sampling, 3 to 5 for each profession would be my starting point, and then it will continue on until we reach saturation. Um, I will also conduct a pilot study at my home institution. Certainly, I would not be conducting the study here at my home institution um, to minimize bias, and because bias is already inherent in qualitative studies, which I'll talk about how to ensure rigor and trustworthiness later on. And what I will do here is use, Zoom or Teams, and that and will activate the transcription feature. We'll download this transcription and essentially kind of verify that the transcription is accurate by listening and rewatching the video recordings. I'll also do a lot of memoing and after the interviews, but we'll take some notes in the process of the interviewing. It is possible that multiple interview sessions may take place with the same individual participant, and that's going to be part of the methodology. So I think I already mentioned the interview recording and the memoing process. And in memoing, it's really important because this is an integral component of grounded theory, where the exercise of reflexivity involves meta-emotional, meta-cognitive reflection, and also part of that is conjecturing, thinking about what impressions am I getting from the interview. But those needed to be written because they will constitute an set of intellectual assets that will help me make some decisions about where the theory goes. So, as mentioned in the framework, the design framework, there are stages to the coding process. There's this initial coding. Other grounded theory design methodologists will call this open coding, where there's initial reading and rereading of transcriptions, where this particular methodology departs from others is studying fragments or samples but then also adding labels about what their properties are. There's a lot of work that done by Saldana on how to do some coding, but there's also um, similar methodologies that were proposed by Corbin and Strauss. Um, then this will proceed to intermediate coding, where initial codes may be connected. Is there any pattern that seem to connect one code to the other? And there's also some elements of what's that connection like? Are they conditions versus consequences? Are there similarities and convergences of the codes? Are there differences or divergences? And as this process continue, there would be a pattern that will emerge where a core category or the central phenomenon may be chosen. And this is now going to be tested in the next phase of the coding, and that is with the incorporation of theoretical sampling. But throughout the process, it may go back to the initial coding again, especially during the phase of theoretical sampling. New insights that tend to depart or may fully depart from the initial central phenomenon will need to be retested once again. So further into the techniques or methodologies in grounded theory, there's this constant comparative analysis that not only matches codes or compares codes with each other, but also at categorical levels to themes. And the idea here is to make salient or confirm or expound the concepts that were initially developed in building the theory. And as mentioned earlier, with the theoretical sampling, the idea there is to establish or confirm the linkages, but also fill in the gaps. And this is where saturation of the data also comes into play. Um, I will, to ensure validity, credibility, and trustworthiness, I'll follow the measure that is proposed by Lincoln and Gube, detailing the research process, accurately representing and the reflection of the informant data, and providing thick, rich descriptions. Um, Furthermore, I will employ triangulation. So that's between the transcription, interview notes, my memos, and of course, in the memos itself, exercise reflexivity, integrity, and criticality. And the last piece here is one member of the dissertation committee um, has is I consider her as an expert in grounded theory. But from a different lens. So as I mentioned earlier, that there's different approaches to grounded theory, and so hers is truly constructivist. I am kind of in between a pragmatist and constructivist approach because what this is meant to generate solutions in the end, and not just to put together a model that may not have an ending to it. As with any research, and this will also be integrated in my IRB, that the study is voluntary in nature, and that there will be disclosure of the potential, though minimal, risk of emotional distress, um, and that there's measures to ensure confidentiality during the data collection process and also during the data analysis all the way until the final write-up of the dissertation and eventual dissemination. And as a token of appreciation, I'll see to it that the participants receive a gift card that is minimal in amount, but it's an acknowledgement of their participation. So what I anticipate here is an emerging theory about how underrepresented minority students in the health professions navigate their programs to achieve success. What I'm cautioning myself, and I'm also putting forth this caution, is the presumption of what academic success is. Um, I'd like for academic success to emerge from the data itself and as defined by the participants, um, with an acknowledgement that I will apply my lens as an educator and a healthcare professional in this process. So truly, what this theory seeks to do is to eliminate the challenges experienced by the underrepresented minority students, and again generate insights on ways to support their success. So that said, I just wanted to end my proposal presentation with two quotes, from one from Pablo Freire and one from Martin Luther King. Um, and again, this is really my inspiration. Leaders who do not act dialogically, but insist on imposing their decisions, do not organize the people. They manipulate them. They do not liberate, nor are they liberated. They oppress. And, I really think of this as being a partner, being in the same boat. So, hence Martin Luther King's quote, "We may all come on different ships, but we're in the same boat now." So thank you very much. And at this time, I welcome questions.
Good. Question. Yep. You took my line. Questions.
I guess one of my questions for you, and so I know you're looking at 3 to 5 from each of the 3 areas, but what about the diversity within those areas? Are you going to try to get African American, Hispanic, and Native American, which were the three underrepresented minorities that you discussed? Are you trying to get one of each at least, or how does that work?
I'm hoping that's the hope, really. Anyway, at least for African Americans and Hispanics, um, there's statistics that are shown in the annual reports from these various disciplines. American Indian, or the indigenous Americans, that is not reported at all. They're
Okay.
they're kind of clustered as others.
Okay,
Um,
so it's hard to
and,
even
and so
identify.
it's less than 1% in any of these disciplines. It may be reported, but it's considered as less than 1%. And where, in kind of again, in my accreditation work, there are very few academic institutions that are identified as serving the indigenous populations.
Yeah.
We can identify the MSIs, the HBCUs, but not much with institutions that serve um, American Indians, and definitely no program. I have not seen, at least in occupational therapy, which I'm affiliated with. I don't have any institution that I know of, amidst the 670 programs across the country that are housed or sponsored by um, that particular category of higher education institution. But yes, to go back to your question, there at least we would get some among the Latinos, Hispanic Latinos, and African Americans. One thing that I am really resisting is not necessarily go into an HBCU, because their experiences may be different, um, or they're known to be different from, say, an underrepresented minority in a predominantly white institution. And so where we see low success rates is in those institutions. We see a lot more higher success rates in the HBCUs. And for a whole host of reasons that are beyond the scope of my work.
So you're gonna exclude HBCUs because of that, or you
Um,
want, or you're just looking at, I guess, where are you getting your 5 institutions in each area?
Yeah, so there's the when I go to, let's say, CAPT for physical therapy, there's a listing of accredited programs there, and what I plan to do is because of my connections through accreditation, so I serve on the accreditation council for OT education. It is more likely that, if there's an OT program at that particular place, there would be either a PT or a PA program. And NDMU, as an example, right, has an OT program and a PA program, and they are rather recent. So it's kind of like, it's an easy connection. And, the institutional gatekeeper may be the dean or the provost or whomever the officer in charge. But I'll backdoor it by starting with the program director who may know me because of some work that I've done through accreditation.
So you're not necessarily looking at specifying whether they're, smaller private institutions or public state schools, or
Correct, correct.
okay.
Initially, Dr. Durham may recall this, that, and perhaps you, during my work, my class with you, that I initially thought of institutions that have a DEI mission, because then that would allow me to um, almost have a guarantee. But then, in looking further and just sampling of institutions that I have done some accreditation work in, um, it doesn't really matter. And then also, what we're seeing as a trend is um, state governments are really making it hard for institutions to have those types of DEI mission because of political affinities and whatnot. So I think what's gonna happen um, in the third phase of the coding, I may tap into more directly some of the MSIs or HBCUs to see if there's any point of departure in theory making. Since the idea is underrepresented minority and does not contextualize it to a certain type of institution, that could be a direction that I'll pursue as a purposive sampling that is theoretically informed. But I don't want us to write that down yet, because we
Yeah,
don't, because
I
as we know
know.
with qualitative studies, something will emerge that we don't expect, and it might lead me to a certain path. We gotta keep an open mind.
Yeah, keep that open mind, but I agree.
I
Thank you.
also, in looking at the submitted proposal, like I don't see appendices for this recruitment part of the work. Do you all think that there's anything to be concerned about him using his position as, member of an accrediting team at times, to reach out to program directors? Like, is there any sort of power dynamic there that he should be concerned about in using them as gatekeepers?
That's not something that we talked about per se, but we did talk about the possible need of having to go through IRB at those institutions
Sure.
in order to recruit, which I think eliminates that power distribution.
I'm just like, I know this is always our go-to, but trying to find affinity groups on social media. Like I started thinking about this when you're talking about the difficulty of identifying Indigenous American participants. Um, that's his whole separate issue. But
Yeah,
like
yeah.
if I wanted to find participants, I might go looking on social media or, in professional organizations, not necessarily an institution that targets itself to Native American health
Mhm.
professionals. Um, but I guess I'm curious whether there are any reasons we think that's not a good approach. And because it's not like he's going for a representative sample in the first place. He's just trying to be sure that he has some representation of these voices among his sample. So, maybe going through social media,
Go through like a
and
listserv AERA or something.
a listserv even. Yeah, I mean, it's hard to get access to listservs like through professional organizations.
But AERA, they might have some.
I don't know if they'd give it to you,
They
but
won't give you the ability to email their listserv, but you can definitely get in touch with, chairs
Yeah, the chair.
or
Yeah.
divisions or something. And I'm sure the same thing is true in other professional
Yeah,
organizations.
yeah.
They'll share opportunities to participate in
Mhm.
research.
Yeah.
But like there may be, God, I'm old. Facebook, there may be some kind of affinity group
Don't use Facebook,
there.
though.
I don't think the kids are on Facebook anymore.
No,
So if
they're
you're
on
looking for
Instagram. The
20
old people are on
somethings,
Facebook.
well, what are they
TikTok.
on? Like
but they
IG?
are on LinkedIn. The
Okay,
young people
LinkedIn,
are
yes,
on
LinkedIn.
LinkedIn.
Yeah.
For sure, LinkedIn. I mean, yeah, I don't know. I would maybe think about it that way because I don't know, like immediately it sparks something like, okay, you're an accreditor, and these program directors at some point you might be on kind of have the upper hand on them and like they want to do favors and I think it's a minor thing, but if you're when you're submitting to IRB, that might raise some eyebrows.
Mhm.
And so you probably want to anticipate that a bit.
Yeah. And kind of, I'm somewhat removed simply because the participants, the target participants, are not the educators themselves.
Totally, totally. But
So,
if they're a
yeah,
gatekeeper, they're
yeah,
giving you access to their students,
yeah,
which is lots of ways to do it.
yeah, very true.
And
I
I think
mean,
it makes it harder for you to have to go through the other institutions' IRBs to get one
yeah.
or two people.
I mean, and it might be that you try, potentially almost as a backup plan, or a secondary plan. You're going to go through your lists and the gatekeepers that you are aware of, but you could potentially also solicit
Mhm.
through LinkedIn or Facebook or like
Mhm.
Rachel said, I'm kind of old too, so I'm on Facebook. It might, but I do think that might allow you to get a broader sample.
Yeah. Thank you for the suggestions.
Yeah,
Yeah,
I've
because
definitely had students that have had success using social media as
Yeah.
a way to solicit participation.
Yeah.
Mhm.
And then also just to go back to Dr. Durham's point about, I have yet to put together an IRB. And so the advertising or the email template and all of that, I did not include that yet.
Which
Even,
is good because it sounds like you still have some options. Once
yeah,
it's an IRB,
yeah,
it's a
yeah,
pain to adjust your approach. So like think
that's,
this through. I mean, maybe do some experimentation with what kind of, if we do an outreach, like asking for interest in this sort of thing,
mhm,
do you get any responses?
Or
yeah,
maybe even just colleagues at those institutions, not
Yeah,
like the dean or
exactly.
somebody who's in administration.
mhm,
Agree.
yeah,
Milk that social network that you have, the
yeah, oh,
professional
yeah,
network.
yeah. Yeah,
And
So
sorry,
the AOTA conference happens in Philly.
Ooh, a conference is a great opportunity.
So that's kind of, and then I participate there's a community of interest of OT educators. Um, that's kind of like my third option. I don't want to wait for the conference to happen, but it's only, the first week of April, and so
I
I
mean, it
have,
may take you a month to get through IRB anyway. Like, I don't
yeah,
think that's
yeah,
so far away.
yeah.
and it's always, especially in the idea of theoretical sampling, as you've gone through your initial 6, 8 people, and you're then broadening that look because of data that has emerged, that might lead you to perfect timing with the April conference
Yeah,
of a way to get then that broader perspective based on the ideas that you've already started to generate from the sample that you started with.
indeed, indeed.
So I have to say, Sal, like the underrepresented minorities in healthcare, of course, is something that like I've witnessed, but reading your statistics was so sobering. Like, I think this, but then to read that this is the reality, this is what's going on. And one of the terms that you have in your lit review that makes perfect sense, that I think is my favorite word of the day, is academic creep, right?
Mhm, mhm. Yeah,
That we continue to kind of raise that bar of what we expect,
yeah.
students entering the professions to do. And then one thing I was thinking of, I know you're doing the qualitative study, but I wonder if you might be able to cut down on just your interview time with folks once you've identified people, just by having like those demographic pieces just in a survey where that might,
Mm,
cut
yeah.
down the number of minutes.
No, yeah, yeah. I actually like that. Yeah. If you consent, fill this form.
Right.
Right.
And that's often how these are, when
Yeah.
they consent to be part of the study, you go to, start scheduling the interview. And in that meantime, you send them a Google form or a Survey Monkey or whatever that has some of those gatekeeping questions on it that then you don't have to ask.
Yeah.
And it also then sets them up if you really are going to do a $20 gift card for every participant that you have, this is their way to get their email address to you to get
Yeah.
that digital coupon or that digital gift card. So it's kind of a win-win for both.
Yeah. Yeah. Thank you.
Okay, any more questions?
Yeah,
Sal,
I
I'm
mean,
gonna put you into the
yeah, I was
waiting
gonna say, I
room.
think this is a great study. It's just, it's a matter of finding the people that can inform it.
Yeah.
And, you know, unfortunately, it's a small group of a small group. And so, getting those participants, we're just gonna have to think about, especially if you don't get a lot of receipt from the people that and we might have to go back to drawing board on that one.
I like to make things hard for myself.
Well, picking grounded theory, you certainly did that. Like
Yeah.
I'm really looking forward to seeing a dissertation that does a good job of theory development. It's not easy. It is
Yeah.
not easy, especially for a dissertation.
All right.
I'm up for the challenge. So
Okay, read
yeah.
lots of grounded theory papers, like examples to see how they do it.
Yeah. And I know you've read the Strauss and Corbin reference, and so just, keep looking at those types of pieces.
Mhm. Thank you.
Right.
Okay. Sal, I'm gonna put you in the waiting room for a second.
Mhm.
And turn off the recording.